So anyway, I was just going to talk a little bit about why it was important to me to make sure that the business that I'm a partner in was COVID safe. Beyond just it being smart business in terms of how, to keep your employees from having sick days and, all of that stuff. Personally, to me, you guys know that COVIDing is very important, right? That's why that I try to put these groups together and help people sort of think through the COVIDing issues. But it's also because not only just as a intelligent seeking person who knows about sequelae and all of those things, my children fall in a really high risk category for COVID. They have an autoimmune condition, post infectious encephalopathy, so that when they get viruses or bacterial infections, their immune system will attack their brain. And because of that, not only is COVID not a great idea because COVID causes post infectious encephalopathy in people with typical immune systems. The issue with my children is they're also on immunosuppressants to control their condition. And one of my kids is actually on a B cell inhibitor, which is sort of the riskiest thing you can be on with COVID. And so I have a personal vesting from a scientific standpoint. I have a personal vesting, as a mom and with my own family. And then I have a personal vesting in my business. We have a clinic. So we have two clinics. One of our clinics opened in 2019 in person in Denver, Colorado. And on July 10th, our second clinic is opening in Wilmington, Delaware. So we have Colorado Clinic and we have Delaware Clinic. And when we opened in 2019, of course, we were on site in person doing our thing. And when the pandemic hit in 2020, we were actually doing a mobile clinic for people on the East Coast who needed to be seen in person at the time when they started shutting the airports down. Everyone remembers where you were when sort of your life shifted for COVID. And I was actually, as the announcements came out and everything, we were worried about getting our flights back to Denver from Maryland. Actually, we were in Maryland. Because of the virus was hitting, and that's when they started canceling flights. And then it wasn't very long after that when the lockdown started. And so we pivoted very quickly from being an in-person clinic to a virtual clinic. And we actually have stayed virtual until recently we're actually reopening, we're opening Wilmington, Delaware first as an in-person site before we reopen Denver. For a variety of reasons, but basically Denver has worked really well as a virtual clinic. We are a specialty clinic. We're not a primary care clinic. So a lot of what we do is care coordination and kind of interspecialty niche medicine. And so the virtual model has been great for us. We there's not really there's a few things it would be that we did in person that were definitely easier that we sort of omit, but for the most part we've been able to function and serve people virtually. And since the pandemic isn't over, we haven't been super in a big push to change that, right? Because we want to still, the safest kind of care that we can provide is to have the virtual care available so you don't have to go in unless it's absolutely necessary. So anyway, but understanding that there are certain things that we do need to actually, be able to physically examine people or put hands on people, and giving now people's expectations also shifting in terms of what they want to be able to come in to clinic, but also quite frankly being sort of pushed into this with the telehealth law changes and the sort of doubling down on this kind of telehealth regulations. We decided to see how we could design a clinic that would be as safe as possible for people with respect to COVID and other infectious diseases. And our clinic, it's a complex care clinic, so we're not primary care. What we do is we take people who have two or more chronic conditions expected to last at least a year that put them at risk of decompensation. And so we have sort of a wide reach. And long COVID is one of those conditions. So So basically, as 2020 came along and our patients started coming down with COVID, we had to very rapidly adapt and learn and look at the research and figure out, how we could best support our patients and what was, what did they need from us in that situation. And we started to see the long COVID and the post-COVID encephalopathy and the post-COVID gastroparesis and all of the other things and sequelae that we have coming along. And so as we learned what COVID could do and how serious we needed to take COVID, that's one of the things that like prompted us to make sure that we stayed to be a COVID safe clinic. It also, it's another condition. If you have long COVID, and then you can come see us, because usually if you have long COVID, you probably have more than one system involved. You probably have some gastro issues, some neuro issues, maybe even some psychiatric diagnoses like depression or anxiety that have come from that. We're seeing autoimmune issues, endocrinology issues that happen, problems with liver, kidneys, those kind of things. And so anyway, that's what our clinic does. And what we said was, with our patient population, right, with people that are already, struggling with chronic health issues, already have multisystemic involvement with their conditions. And like I said, we treat everything from autism to abdominal migraines to chronic fatigue syndrome. We have people with genetic syndromes in our clinic, cyclical vomiting, like the encephalopathies, dysautonomia, Ehlers-Danlos and other connective tissue things. Like, those are some of our like big categories of people that come in. And we have some people that come in and they have sort of this constellation of symptoms that are sort of mystery symptoms. But everybody who's in our clinic, basically has some sort of vulnerability. So it was important to us to be able to offer to our patients a safe place to come and get that medical care. And so when we started researching to figure out, how we were going to open in person. Can you guys see my screen? Can you see the Swiss cheese model? This came immediately to mind. This, they put this out in reference to like personal safety, but you can also think of this too as like public safety, and different ways that you can prescribe it. I want to tell you how funny it was to find one of these. You see where it says hand hygiene? Like, almost every one of these has like a wash your hands layer. Um, and this was actually the most benign one that just said hand hygiene and cough etiquette, which, okay, great. But like, we still have this fallacy even today of like this hand washing to protect us from this airborne virus, but that's an aside. So anyway, we started thinking, okay, what are these layers that we can put into place to make sure that our patients are safe and make sure, that we give the best environment possible. So obviously, the first thing that we said was, well, masks are not going to be optional in our clinic. And it doesn't really matter what the government says. It doesn't really matter what the health institutions say. We are going to have everybody in our clinic. That's possible. Now, we do have people who have developmental disabilities or inability to actually wear a mask that will come into our clinic. But we will, everyone who actually can will wear a mask. And we're actually going to provide, N95. We may actually do some of the KN95s depending, but we're going to provide patients with masks, because otherwise people will walk in with their surgicals, they'll walk in with their cloth masks on, and we really want them to have the kind of quality mask, N95 or better to stop that transmission. And so first of all, we made a commitment to masking, and we made a commitment to actually providing those masks. And then the second thing that we did was, when we were looking at our site, we went for this layer here with this, well, actually, let me back up. So if crowded, limit your time. Well, we're not ever going to allow our clinic to be crowded. That's another thing that we said. We'll do the wait in your car, and then we'll text you or call you when it's time for you to come in. And we'll just have, one family in the check-in area. We're not even making like a formal waiting area. There's a check-in area, so you're not sitting around in that room. Then you'll go straight back to an exam room, and we'll have, we might have a family in the exam room one, and a family in exam room two, and if and then the next family will need to wait in their car, depending on how many exam rooms we're running. until we bring somebody out of there. So made it a commitment to make sure that we have people separated in different spaces in the clinic. And then we went through this to this air filtration and ventilation layer. So when we were looking at our sites to determine where we would locate the clinic, then the first thing that we did was I took my little temp top here. I don't know if you guys can see it or not, but took my little temp top wherever we were looking and made sure that we could have good air quality in indoors in our site. I don't know, is my view weird for you guys? Can you guys see? I don't know, that might be something on my end. Okay, good. Um, so um, so anyway, we happened upon the site for the clinic, and I walked in, and you can see my CO2 right now is 432 in my house because we work hard to make sure that we have clean air in my home. But we actually get 420 to 440 baseline readings in our clinic, and that's because the site we chose was actually it's a multi office building. It's on the first floor, so you can come directly, just you come through a door and come right into the clinic, so you don't have to walk with a lot of other places. But used to, the Department of Defense had the whole second floor rented, I guess. They're not there anymore, but they upgraded the ventilation in the whole building for whatever they were doing up there. And so as we were choosing sites, when we walked in and we found a site that had, you know, that natural outdoor air kind of ventilation in it, then we knew we wanted to seriously consider that site, because you know that gets you the first step in making sure that you are, you know, layering in that kind of protection. And so from there, we said, okay, so we've got an outdoor air level of ventilation, and we're going to be masking, and we're going to be spreading people out, and you know, making sure that they're in isolated spaces. So the next thing we started to look at is filtration. I think when you're looking at the Swiss cheese layer again, and you have ventilation and filtration on the same spot, well, actually that's two separate layers, right? Like how well you're ventilated, and moving your air around and mixing with outdoor air versus actual removal of the virus from the air in filtration. That's actually a separate layer that we can have. And so we started again looking around, and you know, an average, you know, operating room has 14 air exchanges per hour. So that's sort of, you know, I think it was the CDC came out and said every public space needs to have at least 4, but most medical spaces will have 8 to 9. And, you know, looking at an operating room, you're looking at about 14 air exchanges. So we came along and we started measuring, and we started figuring our air exchanges. And actually, we ended up looking at these clean air kits just because they're very cost effective and they have great CADRs. And the other thing that's really cool, plus this one looks kind of cool. The other thing is, if you come on their website, if you ever forget how to figure your air exchanges per hour, then you can come right here. And again, it tells you like good and better and all of that, but it gives you the formula right here. You just take your CADR, which is usually in cubic feet per minute. You multiply that by 60 to get your hour, and then you divide that by the volume of the room. So that's basically length times width times height of the room, and that gives you your CADR, how many air exchanges per hour that you can get. And so we started measuring and we started figuring, and we're actually going to be getting about 35 air exchanges per in our exam rooms. We've got about 26 going in our bathrooms. The least air exchanges that we have is actually back in our provider space, and it's 12. So it's still really good. And we're actually looking at this not as overall clinic footage, but we're breaking it down into those smaller spaces and putting the filters in every space to really boost those air exchanges. So now we've got masks, now we've got ventilation, now we've got air filtration. But we can still do better, we said. We said we are determined not to have anybody in our clinic get COVID from trying to access medical care. So and I was going to show you. So we're we're doing the clean air kits in most spaces, but our bathrooms are really, really small. They're like 4 feet by 4.5 feet. And so we're actually able to get those 26 air exchanges per hour in the bathrooms just by using these little Metifies that save a little bit of money, but are still pretty decent little filters. So that's what we chose there for the bathrooms. And then we said, okay, well, we've got filtration, ventilation, masking. The next thing that we're going to do, which actually is not even, on this kind of little chart, I guess, maybe this stay home if you're sick, but is we said we want testing. We want everyone who comes in our clinic to have a test. And at first, we were going to have the NAT test. We were going to either get some Q machines or we were going to get the Luceras. We talked to the different reps and found the different rates, and we were trying to figure out what we wanted to do. And then, of course, the EUA ended and the state of emergency ended, and that really affects our ability to bill for those kinds of tests. And those tests, they're not cheap, right? And so from a business perspective, I'm all for it, right? I'm like, well, we're just going with it. We'll just try it. And the money people, like I'm on the clinical side. The people who are on the money side were like, hold up, Kara. You're going to have to think creatively about this, because that's, we can't just be handing people $50 tests when they come in the clinic, or even $35 tests when they come into clinic. That's too big of an expense. And so we started looking around, and actually, I think the buzz started first on Twitter, but we started looking at the data for actually the FlowFlex rapid test. And most rapid tests, are not really like their accuracy isn't really great, right? And they're probably missing about 60% of infections, honestly, generously. But FlowFlex evidently has a little bit of a different sensitivity, and I don't pretend to understand exactly why. But people started buzzing on Twitter saying, hey, these FlowFlexes are running right up there with PCRs. And of course, we're skeptical. We're like, are you sure? But when we started looking at this report and this data, so they had, several different clinic sites, and they had a fairly decent sample size, and they actually compared the FlowFlex to PCR testing. And I'll just flip down here at the end. And in conclusions, they had, 605 specimens, and they came away with a sensitivity of 97% and a specificity of 99%. So that gives it an overall accuracy rate of 98% on a rapid test. So when we started looking at a clinic, and we wanted to include testing as a layer, but we couldn't really necessarily afford to do these, the NATs or the PCRs. We weren't sure about even access to some of them. The FlowFlex became a fairly, a good option for us. And these tests, you can find them for $6 or $7. And we said, okay, that's a cost we can bear. So we're actually bearing the cost of we're bearing the cost of handing out the high quality masks, and we're bearing the cost of the filtration upgrades, and we're bearing the cost of testing people who come into our clinic, just so that we can keep everybody safe and not participate in the spread of the pathogens. And then finally we said, okay, well, we've got testing, we've got masking, we've got ventilation, we've got filtration, we've got everybody spread out and moving through the clinic in a flow where they're not sharing the space. What else can we do? And that's where we came into our UV, right? And so I don't want to revisit everything that, Beacon said, but basically after looking at what was available and the way that it could be utilized, we are going to use Beacon in the clinic. We're using it particularly in areas where, not just for COVID disinfection, because FAR UV also kills things like staph, and it kills things like other kinds of pathogens. It will actually deactivate mold spores. And so it's another layer of protection. We're not using Beacon or FAR UV to take off everybody's masks or anything like that, But for example, when we have the developmentally disabled person that comes into the clinic and can't wear a mask, or other people for various reasons, then we have the far UV in addition to the somewhere between 12 and 30 air exchanges in every space, and everybody else masking and the testing layers, so that people who come into our clinic can be assured that we've done everything that we can to try to make this a safe space. And then finally, the last thing that we are doing is we are keeping a hybrid model. So you can choose. You can come into the clinic in person when you need to, and you can have a virtual visit when you need to. And, there's no criteria for getting a virtual visit. It's just completely up to you when you need to come into the clinic and be seen in person, or when you want to be seen from the comfort of your own home. And so I think that, there there are some extra costs that businesses have to be willing to bear, or pass on to the consumer, right? And then that becomes an accessibility issue and all of that. We have patients in our clinic with private insurance. We have patients in our clinic that are on Medicaid and public assistance. We wanted to be all of our layers that we're implementing to be accessible to all, including the masks and the testing. So we're picking up those costs because it's important to us to keep everybody safe. And so that is something that you have to have a commitment, sort of, as a society, and as a business entity, to actually implement these things. But luckily, I have really smart business partners, and everybody understands that, from the business side of things, the more we keep our providers safe, our doctors and our nurse practitioners, the more patients we can help, and the more we keep our patients safe, then we build the credibility in the community. Because what does it look like to me when a medical professional doesn't wear a mask or take COVID seriously when they're dealing with somebody who is an at-risk patient or is immunocompromised, or even for themselves? Do I really want a medical provider that has COVID brain fog and long COVID cognitive impairment making my medical decisions for me? These are real things that we have to look at, as a society as a whole. And so that's how we came to our conclusions. And that's what we're going to offer to the public, and we'll see. I'm really hoping we get some positive feedback, because that's always well and good for for your investors. You want to show them that the money that they're spending to protect people is appreciated and actually a selling point, not a detriment. Because they're arguing, well, what if people don't want to wear masks? What if we get too many complaints that masks are required? And so I had to sort of, we had to sort of troubleshoot and think of well, maybe if we get too many complaints that masks are required, maybe we have one day at the end of the week that you can come in without your mask on at your own risk, but we still have all of the other layers in place, and we don't bring anybody who doesn't want a mask in, or things like that. Like, we have to be viable as a business, but at the same time keep people safe. And so I'm really absolute. I'm like, nope, mask never, whatever. But we can't, if I can do 4 days a week for people who understand and want to be COVID safe, and I have to sacrifice masks on 1 day a week for people who may not feel as strongly about that, with all the other protections in place that we already have, and the staff will always be masked, the providers will always be masked. I'm actually wearing a PAPR in clinic. Then that kind of trade-off and that kind of flexibility as we problem solve and look at these tools that we can utilize, I think is important for all of us. So that's where we are. I did want to show you guys, just in case anyone is in our area and interested. You can go to our website, which is lighthousecomplexcare.com. And like I said, the clinic that we're talking about having, you can always be seen virtual if you're in Colorado or some of the surrounding states. You can be seen in person or virtually from Delaware. And that's the clinic that I'm actually talking about, that we're implementing as a model moving forward. We do take insurance. We are in the process still of becoming in network with most major payers. Right now, we're in network with United Healthcare and Aetna and Highmark, Blue Cross Blue Shield, our Medicaid is still and Medicare is still processing. So we're hoping by the time the clinic opens that those will be in there. We also have licenses, and with the new telehealth laws, you have to have a license in the state where the patient is located. So we are accepting patients from Delaware, Pennsylvania, Maryland, Virginia, and Ohio for the virtual consults. Those are where our licenses are located. Now you can live in a different state and drive to a bordering state where we have a license to have your visit and still have a virtual visit. You don't have to be domiciled in one of these states. You just have to be located in that state at the time of your visit. So you can be in your car, sitting in the parking lot of a Starbucks, stealing their Wi-Fi, doing your virtual visit, and as long as you are in one of the states where we have a license. Our Denver clinic sees a separate list of states from that location as well. So if you're interested in virtual, and you can check out either site for the locations where our providers are licensed. I think we're licensed in 9 states. So um, with that, I will take any questions or comments about what we've talked about. I'm trying to figure out how to unmute you guys.
I have a question.
Mhm.
I want to ask you about your beacons. How did you figure out how many beacons to get for the space you have and how to position them?
So long story short, um, there is actually called the article, the early adopter article. Do you remember? Do you know which article I'm talking about? There was a UV analysis by. It's called an early adopt. I think it's called FAR UV and early adopter. Um, I started out actually looking at the Krypton and the Krypton shields from the FAR UV company, and then found out that Beacon uses this exact same bulb, and the price on Beacon is so much more affordable, right? So we want to support the company that's trying to make the price point affordable, not just for corporations, but also for the individual. And Krypton actually, I mean, FAR UV actually has a lot of data. They've been working with the Department of Defense since like 2020 when they were putting them in airline hangars so that their pilots wouldn't get sick. And they have a lot of data on their site for that bulb and the reach of that bulb, and how effective it is at what distances. And so the combination of really the data first from the FAR UV site, and then that early adapter article actually walks you through also the different kinds of FAR UV that are available, and how far out the manufacturer claims that they are effective versus how far out then he really thinks as a sort of an engineering kind of person that they would be effective. And then talking with Beacon and getting the Beacon specs and all of that, that's how we sort of became comfortable. Our spaces, again, they're not super huge spaces. So we already understood you can't shadow the light, right? It needs to be, basically where you can get the whole cone, and wherever there's a shadow, then the light doesn't work. We also understand that one of the ways to maximize your UV is to combine the filtration with the UV and use the filters and the fans to move more air in front of that light, as also like as a sort of a secondary enhancement, right? There's actually articles, I think Joey Fox did one on how many more air exchanges that UV light actually gives you the equivalent of. And so if you take your filter and you position your light where you're pretty close to where your filter output is, then anything your filter's not filtering out, your light can kill. Or vice versa, you can put your light, basically again, sort of at the intake of your filter, and then it's killing things, and then the air, what it doesn't kill, it's going into the filter and coming back out. And so all of those pieces of information together basically told us that in our exam rooms and in our bathrooms, we just need one unit to get that kind of enhancement. we have a little bit of a bigger space in that check-in area, and so we're going to cross beam a couple of them to, provide some added protection when people walk in before they've had their COVID test, and maybe they're walking in and getting their mask on. So we wanted some extra protection there in that entry area when people are walking in, and we're checking out their mask and then getting them into the rooms to get their COVID test done. So I know it's not a really very precise answer, but our ceilings are 9 foot. So we knew that we had the optimal 8 foot, and we just went in and then looked in the rooms and said, okay, it can't go here because then the cabinet's going to block some of the light. It has to go, over here. And then this is where we can put our filter. So this is how we can sort of maximize the pool of the filter and the fans in front of that UV. Because if your air is not moving well, right, then, and your UV's in a certain area, you want to keep pushing that air as close to that UV bulb, in front of that UV bulb as possible, to get the maximum kind of, quick eradication of the virus. And so those are the kind of things that we took into consideration when we did that. I think you guys can unmute yourselves now. So there's not very many of us. I think we can, like I said, just have it a little bit more conversationally, since there's nope, it won't let you. Oh, that's my lack of technological prowess. Allow participants. It says that you can unmute yourself. Okay, well, here you go.
Hi, thank you so much for this presentation. And I just think you have the luckiest patients, and you should be so proud of the practice that you have built. This is state of the art, and it should be universal. And I think you should be our CDC director, but I don't know if you want that job. But I volunteer with the World Health Network, and they have COVID meetups, which I don't know if you've seen, but there's a place to put COVID safe medical practices, and I'll offer that to you to put your information, or I'd be happy to share your information there for you if you'd like.
Absolutely. Yeah,
Okay.
thanks. That would be great. Would love to get the word out. And because this is, again, one of the reasons that we exist, is to serve the population that still cares about the pandemic. And so, honestly, if I could fill up we have a sign up list right now, until we open clinic and start scheduling, probably in about a week and a half. We have a sign up list. And it says the reason that you want to be seen at our clinic. The more people that we get on that list that say, I want to be seen at your clinic because it's COVID safe, then again, the more our investors will come back and say, yes, spend more money and keep buying those masks, keep doing these things, versus, looking and going, all right, we're spending a lot of money, and, no one's coming here for COVID care. So if nobody cares, why do we care? So it would be great to put the word out and to get as many patients who share our concerns. That's part of the problem, I think. We don't have a whole lot of coordinated efforts. We're a minority, right? Most people now in the world have had COVID, and have sort of accepted it as a recurring infection that they're just going to endure and deal with. And so the people that are still actually taking COVID precautions are a minority, but we're not very good at banding together and being a very vocal minority in our advocacy. And so the more we can do that, the more we can, support each other in our endeavors, and also the more we can get the word out. Hey, look, it's working over here. This clinic takes Medicaid, but they're still able to keep their patients safe. Then I think the better off that we all will be.
And I'm sorry to keep talking, but if you ever want to, I'm not sure I can really offer this up, but it's possible that they could do a profile of your practice and the precautions that you have and push it out through any of their social media or their website. So if that's something you'd ever like to think about, I know there's pros and cons, but I could talk to the folks there as well.
I think at this point, any way we can reach because the World Health Network reaches the people who care about COVID, right? And so any way we can reach our people and let them know, because that's what I mean. I found a person COVIDing 6 minutes from my house, and I thought I was all alone in my network in my area because we don't go out and socialize, right? Like we are so busy isolating and keeping ourselves safe that we don't even know where each other, we don't know where we are, and so I think anything that connects us as a community is important, and that would be great. So I'm perfectly happy to, again, polish up a little presentation and give it to people, or I'm working on our website right now. Our website doesn't have our COVID precautions listed prominently, but we're looking at maybe having a pop-up that gives our COVID precautions when you log in, and a whole page, basically just saying, okay, well, here's our ventilation, here's our filtration, mask required, all those kind of pieces. I'm working on getting that on the up on the website so that people can know and find us too. But we really do want people, especially because, over here on the East Coast, we're compact, right? Like I said, like we're at the junction of Maryland, Pennsylvania, New Jersey, and Delaware. We're about 2 hours from New York City and about 2.5 hours from DC. We're about an hour and a half from Baltimore. There's a lot of people that are within driving distance of our clinic that may need medical care for something and may just not know where to get it. So we would love to just for people to know that we're here and that we can support them. Now, again, we don't do primary care. So it's not like we're going to be able to sign the sports physical paper or something like that. But our reach is actually pretty broad in terms of like the majority of the population in the United States will have, a psychiatric diagnosis and one other health condition that they want to treat, and that's right in our demographic. So.
I
Do you have a
wanted to
call?
ask about the beacon again. Do you keep it on 24/7?
So we will. Yeah, we'll keep it on 24/7 in clinic, especially because I want it to be disinfecting overnight, especially because it gives you it will disinfect surfaces. And depending on how far away the surface is from the light, it takes longer, right? And so when it's unoccupied and it's on all night, then that's a really great time for us to go ahead and disinfect surfaces. Oh, I forgot to show you guys. We also have a couple of these Apollos. Have you guys seen the Apollos? So these are actually UVC, which means you can't be in the room while they're on, but they come with a little remote control, and they also come with on the top, there's like a little timer that you can set. If you happen to walk in the room when it's on, it's got to shut off. So if a pet or a child or you walk in the room, it's got to shut off and will turn off. But we'll be using these for example, like we have a hyperbaric oxygen machine. And so when somebody uses it and leaves, then we'll be popping the Apollo in there for a disinfection cycle. Also, we're hoping when we'll keep an eye on the bathrooms, right? And we do have the beacon in the bathrooms and the filtration in the bathrooms. But again, this is just another strong layer. We can pop it in the bathroom when someone goes in there, shut the door, let it run for 15 minutes, pull it out, and it's just another stronger kind of wavelength for UV disinfection. And they do use these. They use these in operating suites, and they use these in hospital settings. A lot of times, these are the ones that this kind of UV is what they'll use in the in the ventilation systems in places, or up in the ceiling, so where it's not shining on people. But we have a couple of these portable Apollo UVC units too to also help with the disinfection. And we use this all the time. Say someone comes into our house to work on our, heating unit. Well, we vacate the premises and we have our air filters going. And then when we come back, then I said this also has a guide for how many square feet it will disinfect and how much time. And I can put this in that room where the person was working and run it a cycle and kill COVID in the air for when that repair person was in here. Or we've taken a couple of trips and stayed in Airbnbs. And we take this room by room. We usually start with the bathroom and we put it in the bathroom, run it on the appropriate room cycle, and we keep our mask on until this has gone through, every room in the space, and we've had our air filters going in the Airbnb long enough. We only stay in the single units, but we come in and we disinfect with UV, and we run our air filters for the prescribed amount of time, before we try to get about 6 to 8 air exchanges, plus the UV disinfection before we take our mask off in an Airbnb space. And so again, it's just about having the tools, so that you can protect yourself, but still be able to, stay in an Airbnb, or, have someone in your home to do a home repair that you can't do by yourself. Those are the kind of things that we want to be figuring out, I think, as a society, since we know now that this is, going to be our steady state for years. We need to figure out how to coexist safely.
I have another question about the beacon. It's just because, as you know, since I helped you organize the beacon presentation, I got all those questions from all the members and
Mm-hmm.
gave them to beacon. But there are quite a few members that are concerned about being there with the UV on for various reasons. So do you anticipate having anyone come in and say, oh, I don't want the beacon on when I'm there?
Honestly, I really doubt anybody even notices. I mean, they're up in the corner of the room. They're not very obtrusive. And to tell you the truth, if we had somebody who came in and said, I'm really horribly worried about that UV and that beacon, I would just turn it off. I've already got 30 air exchanges in the room. So again, at this point, it's gravy. And I wouldn't want our patient to feel uncomfortable, at that cost. Now, if they came in and said you have to turn off your air filters, that would be a no-go. I do feel like that for us in our particular situation, the beacons are an added extra layer, and we have enough other layers that if someone were super concerned about, the microbiome on their skin or something like that, then we could turn it off. And they turn off by app really easily. So you just have the apps on your phone, and if somebody doesn't like it, you can turn it off while they're in there. I wouldn't hesitate to just turn off the beacon while I had a patient in the room. Now, if you were at my house and you asked me to turn the beacon off, we might have to have a little discussion about it. But in that kind of healthcare setting, then we want to respect what the patients need. But I really don't anticipate people. I mean, I don't know if you've seen them, but they're like tiny little things that are going to be stuck up in the corner. That Oh, you bought one? Yeah. Yeah, I really don't expect to really get much pushback on those. It's just my general sense of it is that people are not even going to really notice it. They'll notice the pretty air filters because they're going to have lights. But
You know, the air filter, I never saw that. And what, can you put the screen up again?
yeah,
Oh, air filter.
yeah. So these are great. Let me get back over to the screen. These clean air kits. So, like I said, I have Medifies at my house, and I like the Medifies. But when these came out, the pricing on these for the CADR, I don't think you can beat it. For larger spaces. Like I said, the little Medify will do the smaller spaces just fine. But the prices for these, and plus these having the PC fans, they're going to be a lot quieter than your other kinds of filters. That's why they've built them. So
So
you can get.
is this the Corsi Rosenthal?
It's a fancy Corsi Rosenthal. This
Oh,
this is a Corsi Rosenthal, but instead of a box fan, it's got PC fans, and you can actually get it. Do it yourself stem where they just send you the pieces if you want to put it together, or you can get it pre-assembled with the filters already. And this one has the cool little rainbow lights in there as well. So.
well, this is supposed to be better, right, in terms of air purifier than the standard ones.
Same. Like your CADR is your CADR, right? Like how many exchanges per hour you get is how many you get. So I wouldn't say, I'd say the advantage of these is that they're going to be a lot quieter. They've measured the decibels, and you have the box fan versus you have these tiny computer fans that don't really make a lot of noise. So again, for us in a commercial setting where we're trying to talk to patients, the advantage of having these being quieter plus the cost savings over like I said, like the Medify filters or some of the other filters that are actually, built to be sold commercially. This was a better value. And it actually, I mean, plus, like I said, they're a little bit more sleek than having the big Corsi boxes in. I mean, I know you can build your Corsis a lot of different ways, but I'm sorry, I have a lot of things to do in my life and don't have a lot of time to build Corsi boxes, and especially to be creative in my Corsi boxes. I've seen people making like Corsi chandeliers and stuff, and I'm in awe and envious, but that's not something that I can really take on at this point. And so these being, having the option for pre-assembly, plus being a lot quieter, plus having like the value, like I said, to get this kind of air exchange, well, you can just see. So you can come down here and see. So this air exchange is 340 cubic feet per minute. And if you go to the Medify site, let me see here, and you look for 340 cubic feet per minute. So remember, let's see, remember that we had, this one is going to be about $300 for that 340 cubic feet per minute. If you go to the Medify and you want something that gives you 340 cubic feet per minute, I'm guessing you're probably going to be looking, maybe guessing something like, let's see how many. You have to go down here to their chart. Okay, here we go. So this is 85, 88, 94. To get up here to the 300. So I'm somewhere here between here and here. So 325 isn't bad. They probably come down a little bit, but between 325 and 595. And when I just went and looked at the cost per cubic foot per minute, the clean air kits seem to be a lot better. So I guess you could get close with this one, but I think on the bigger spaces, the bigger you get, the more expensive it gets for these many. Oh yeah, see, it's come down. It was 449 from that versus that 300. So it's just a little bit better price point. Plus, I like supporting the people that are trying to support the Corsi boxes, right? Like that's been one of the greatest tools, I think, of the pandemic, being accessible and getting that out there and crowd, sourcing and pushing the Corsi boxes as well. So,
Do you know with those Corsi boxes,
Mhm.
when let's say there's a bunch of people with COVID in the room and it goes into the unit, does it inactivate the virus or does it just contain
no,
it?
it traps it in the filter.
Okay.
It doesn't actually kill it unless you have like an ionizer or a UV there. It, basically traps it in the filters.
So if it's trapped in there and
Mhm.
then you try to take it apart to change the filter, then does it release or what happens?
I'm not a virologist, but if you have, I mean, it's going to depend on how long it's been sitting there, right? Because COVID can live on different kinds of surfaces, different time. But you're talking about something that's incredibly tiny. You're talking about something like microscopic, right? So the probability that you would get enough viral load in one of those filters and then dislodge enough of that for you to inhale enough to infect yourself, it's going to depend on a lot of variables. I'm not going to say that it's impossible, but it's probably highly improbable. Unless maybe if you had someone with COVID sitting there at the filter going and like blowing into it and filling it up, and then you took it and shook it on yourself, then maybe you might be in trouble. But in general, it's just like if you were around someone who had COVID and you had your mask on and you were breathing, and that mask was catching it in the elastomeric layers and trapping it in there. You still usually touch your mask and take it off and whatever. And that kind of fomite transmission, you have to think about, it's not only how long does a virus live outside of the body, how long does it live in the air, how long does it live on a surface, and then it's how much of it lives there and how much of it can I transfer. And so fomite transmission is not zero. We do know of cases where you can have a heavy viral load on an object and touch it and then touch a mucous membrane or something, and possibly infect yourself, but it's extremely rare. And for that to happen, like with something trapped in a filter, medium, I would just say if you're concerned about it, put a mask on when you're changing the filter, and then throw it away. But I wouldn't be overly concerned. The other thing you could do is, I don't know if you've seen, I've posted in the groups before, we have those little UVC wands, and you could take a little UVC wand, you could UVC wand over it before you changed it. And that UVC would also kill anything that was up on the surface. It wouldn't kill something that was trapped in the interwoven layers, because it actually might block the light, the shadows of those layers might. But it's pretty permeable there. So you could take that UVC, run that UVC wand over it, keep your mask on and throw the filter out.
Would the beacon do that if you held a beacon? Is it UV also?
Yeah, beacon would do it as well. I have a handheld wand, right? So my handheld wand's just easier than pulling the beacon probably off the wall. But yes, beacon would do it too.
So when you're in the clinic, you are wearing your clean space halo?
Yep, I'm gonna wear the halo.
Does anyone else in your clinic wear PAPRs, or just you?
Well, PAPRs aren't filtered on the exhale, right?
Right.
So I'll have to wear my clean space, and then I will have to wear a mask over the clean space to keep it safe for the patients. So far, my daughter will also wear a PAPR when she's in the clinic, but all of our medical professionals so far have opted for the ergomis. They like the way the ergomis look, and we will, of course, be fit testing them to make sure that they fit properly as well. I guess that's another layer, right? Fit testing your masks.
I'm looking forward to the clean space presentation next week, Friday, because I'm going to buy one for sure, a halo, and I don't know how much of a discount they're going to give us, but I'm hoping a lot of people attend that, so they'll give us a good discount. And I just loved looking at yours. The time you did the presentation with it on, I could hear you quite clearly.
Yeah.
So
no, and I've worn it now to several different business meetings, or to look at the clinic space and do different things. And you can definitely, you can hear people just fine. And actually, I was worried about possibly, like I said, well, there is some fan noise. You might be able to hear it. Say if you were in a quiet movie theater and you were sitting next to somebody, that might bother them. But the other day, one of our group members who lives next to me rented a private showing of a theater.
I saw that.
Yes,
awesome.
and she got the manager to let us in the back door so we could walk directly from the parking lot into that theater, where there was nobody but the 8 of us, the 4 people in her family, the 4 people in my family. And we had PAPRs on, right? And it was fine. It was not loud at all. By the time you got the music blaring and the movie going and all of that stuff, you couldn't hear the PAPR for anything. And so the halos anyway. So yeah, I think it's pretty much, you can do, that's why I asked, what would you not do in your PAPR, right? You wouldn't go swimming in it or go in the shower with it or something, but beyond that PAPR technology can keep you really safe. So
I'm looking forward to buying one. I'm so excited because it looks like a P100 mask.
Yeah.
Because as you know, I have the 3M that goes over your head. That one's pretty obvious. So
yeah. I will just
want to use the clean space.
For the people who haven't seen it, I'll show you here. This is where I think Sandy's saying that she talked about. So these are my children. And you can see here that she's got an origami on. He's actually just got a black surgical over the clean space halo. You can't even really tell that they have anything on beyond their regular masks. They're fashionistas. They want to make sure that they just, they're teens and young adults. And so and we were wearing these, to cover the exhale valve out of respect for the other family that we went with, right? They were not for our protection, but for theirs. And we were also all tested. We were Lucira tested the morning of before we went in. So, but anyway, that's that unobtrusive PAPR that we're also using in the clinic. Then my little ones in the clean spaces are too big for my little one, so she's in her P100 secure click, but she does actually now have that VersaFlow, the one that you got and you checked out and found it was safe for us. I was like, all right, great. So now she's got a VersaFlow. So anyway, All right. Any other comments or questions or?
Thank you. I really enjoyed this.
Yeah, well, thank you guys so much for coming out, and I hope maybe we've sparked, like I said, I just want to spark the conversation, and let people know that there are ways that we can do things like get medical care without having to expose ourselves to a debilitating, ongoing pandemic.
I wish you were in each state.
Thank you. We do hope eventually, we will probably have more clinics. Like we'll open, we're opening Wilmington, then we'll open Denver probably back up. And I think the next state that we'll be in is actually Texas. But we do hope to be able to service more people. And even if we don't open the clinic, we hope to be able to sort of document this and push the word out there to other clinics. So then maybe other clinics can use the model and see that it is sustainable and that there is a need for COVID safe medical care.
Thank you. Thanks.
Closest court of Pennsylvania is an hour and a half drive from me. Yeah, well, you can snake into that corner and get you some virtual care. But yeah, absolutely. Well, thank you guys so much.
Thank you. Bye-bye.